Do you have to rely on caffeine and willpower to get through your day? Otherwise, you're totally dragging. Are you sensitive to cold temperatures? Do you have this unshakable brain fog or even depression? If so, you may just have hypothyroidism. It's estimated that 20 million Americans suffer from some form of thyroid dysfunction, and many are undiagnosed. Most of them have hypothyroidism, where the thyroid gland doesn't make enough hormone to supply the body's needs. Hi, I'm Yvonne Carney. I'm a medical doctor practicing functional medicine in Crystal Lake, Illinois, about an hour outside of the Chicago suburbs. I believe we all have a God-given mission on this earth, and we need energy in order to do that mission, and we need vibrancy, and that's what I want to help you create. Now, a lot of people have underactive thyroid. Today, I'd like to give you some information that will help you increase your energy. First, though, let me talk a bit about functional medicine. And in order to explain it, I find it helpful to give you some contrast between traditional medicine and functional medicine. So this is what I'm going to call the functional medicine tree. And the leaves of the tree are our organ systems. Now, traditional medicine gives us diagnoses of illnesses based on which organ system is damaged. And then they have specialists that cover every organ system. But functional medicine looks at the root of the problem. What is causing the disease? Well, we believe it's inflammation, and inflammation can be caused by stress, nutritional problems, infections, or environmental toxins. A lot of things have to go wrong in order to manifest enough organ damage to have a disease. So functional medicine tries to be proactive and prevent the disease from happening, whereas traditional medicine waits until there's enough damage that they can label it and give it a diagnosis. But I digress. I want to talk to you today about thyroid, how to identify thyroid problems, and what to do about it if you do have them. Now, the thyroid gland is located at the base of your neck, just below your Adam's apple. It's responsible for energy production, thyroid hormone. Thyroid hormone is what helps your body make energy. And that, my friend, runs everything. Energy runs everything. I have to admit it, I'm a little bit of a chemistry geek, but this is important and I want to make it practical for you. We have a God-given spirit, and the rest of us is biochemistry. And biochemistry is like a factory. In a factory, you have raw materials, and that comes from our food. A factory needs factory workers. Those are our intracellular enzymes that make things happen through chemical reactions. Factory workers need tools like hammers and screwdrivers, or they wouldn't be very productive. And that is the vitamins and minerals that we get either from food or from supplement. But nothing would get done in a factory without energy. Thyroid hormone is what makes the conveyor belts run and turns on the lights in your factory. What are the symptoms of hypothyroidism? Well, basically the questions that I asked you at the very beginning: fatigue, unexplained weight gain, cold intolerance, depression, dry skin, constipation, brain fog, hair loss, and if you're a woman, menstrual irregularities if you're still having periods. There are many things that can lead to thyroid dysfunction and hypothyroidism. Nutrient deficiencies like iodine, selenium, and zinc can lead to dysfunction because these are crucial for proper thyroid function. In the United States, autoimmunity is actually the #1 cause. Yikes. That's a big red flag if you have autoimmunity, that something deep and wrong is going on with your immune system. Of course, if you've required surgical removal or radioactive ablation of your thyroid gland, you're going to have no hormones at all, and that's definitely hypothyroidism. So I want to talk a little bit about what thyroid tests you need. And I'm going to go over them in the order that I think they're most important and not the most commonly ordered. First is free T3. I think free T3 is the most important hormone because it's energy. It's energy. It's money in your pocket for energy. It's what stimulates the cell receptor to trigger the energy production. Reverse T3, I think, is the second most important hormone because it blocks the receptor. It doesn't fit right on the receptor, so it doesn't trigger the energy production. In fact, it gets stuck there, and you can't have two hormones on the receptor at the same time, so it blocks it. It's kind of like a right hand and a left hand. T3 is your right hand, and reverse T3 is your left hand, and the hormone receptor is a right-handed glove. Thyroid antibodies, I think, are the third most important hormone. And the reason is because, like I said, if you have autoimmunity, it's a big red flag that something screwy is going on with your immune system. Free T4 is an important hormone, but it's not the active hormone. It's the hormone that your thyroid gland makes, but it has to be converted to T3. Now, TSH I have last on the list, and unfortunately, that's the only hormone that most doctors are trained to check. It signifies how well the brain is supervising the body. TSH stands for thyroid stimulating hormone, and it's made in your brain. It's supposed to be the supervisory hormone, but I have seen plenty of instances where the TSH and the free hormones do not correlate. Now, once you get your levels checked, we need to talk about how to interpret them. And here's where you need help. You need guidance, someone who understands the difference between normal and optimum. This was really one of my aha moments as a doctor when I was practicing conventional traditional medicine, that I needed to broaden my horizons and learn more. And that is, doctors are trained to look at normal range. I seriously used to be able to interpret or go through 10 pages of labs in 1 minute or less, because I would just scan through the pages and I would look for highlighted highs or lows. And if I didn't see any, then I would put the paper down and look at my patient and say, your labs are normal. But here's the thing, normal is set by lab companies. Normal is not set by doctors. And the lab companies specifically set normal range to include 90% of the population by using the bell curve. So they find the spot on the curve where 5% are too high, 5% are considered too low, and if you're in that middle 90%, you're called normal. Do you honestly think that 9 out of 10 people walking around are optimally healthy and vibrant? Do you really want to be like 9 out of 10 people? I think maybe 1 out of 10 is optimum, and that's what I want for my patients. I want optimum, not normal. Normal is simply not good enough. So back to thyroid hormone. I think it's important to understand the metabolism of the hormone, and I hit on that a little bit when we were talking about what tests to get, but this diagram makes it clear. T4 is made in your thyroid gland, but it's not the active hormone. It must be converted to T3. Now, again, here's where it gets tricky. So I want you to take a moment and look at your 2 hands. They're similar because they each have 4 fingers and a thumb, but they are not interchangeable because the thumb's in a different place. So again, shape determines function in biochemistry. The hormone receptor is a right-handed glove. T3 is your right hand, and reverse T3 is your left hand. If you make too much reverse T3, it blocks the receptor and prevents the active hormone from stimulating the energy production. This is really where functional medicine comes in with thyroid function. What are things that increase reverse T3? Stress, environmental toxins, starvation, inflammation, nutrient deficiencies, and certain medications. If you have high reverse T3, you will most likely feel hypothyroid, even though you might have normal T4. And even if you have T3 in the normal range, if you have a high reverse T3, the true T3 can't activate the receptor. So you will feel hypothyroid. Importantly, if you have a high reverse T3, treating with thyroid hormone is not the best answer. The best answer takes a lot more work, and that is to figure out what in you is triggering the elevated reverse T3, and how do we go about reversing that. What about if you know that something's not right and your thyroid hormones are truly in the normal range and maybe even optimum? This is something that I call thyroid hormone resistance. And this is something that I believe we have physiologic evidence for, and the science makes sense, but it's not really talked about in traditional medicine. The thing is, when you check a blood test, you're checking what's going on in serum, in the bloodstream. But all the action, all the energy is made inside the cell. In order to get from the bloodstream into the cell, you need to have a hormone receptor. And the hormone receptor sits on the cell membrane. So we have to have healthy cell membranes to have healthy hormone receptors to have normal thyroid hormone function. And so just merely checking a blood test, if you still feel sluggish or brain fog or hypothyroidism, it could be that you have cell membrane damage and you are suffering because the hormone can't access what it needs to get to inside the cell. Again, I'm a little bit of a chemistry geek, but this, to me, this picture I absolutely love because it is how I picture health. This is a picture of your cell membranes. And your cell membranes are made out of fat. So the two layers here that you see separated on the left side are phospholipids. It's like a sandwich where each piece of bread is made out of a layer of phospholipids. And then the green-like structures are toothpicks. They're fatty acids that hold the two layers of the phospholipids together, that keep the bread together. And the little yellow parts of the cell membrane here that you see, that's cholesterol, and that's what you need to help your cell membranes be strong. Now, hormone receptors, like receptors for thyroid hormone, reside on the cell membrane. If we don't have healthy cell membranes because of unhealthy fats in our diet or environmental toxins that damage the membrane, then the hormone receptors don't have the same shape. They don't work right. And then even enough hormone doesn't trigger the right reaction. So in my practice, cell membrane health and cell membrane healing and regeneration is really a crucial, crucial piece of health. But I digress again. I really want to give you some steps today to help balance your thyroid and get healthy. In functional medicine, we have a saying that says, start with the gut. And that is because inflammation is the root of illness, and a lot of inflammation starts in the gut. So how do we heal gut inflammation? By eating well. I'm going to give you three things. First, eat real food. Don't eat processed food. Don't eat chemicals. Chemicals are damaging. Number two, try to avoid grains. Grains have three problems. One is, in our country, most of them are sprayed with glyphosate, aka Roundup, 2 weeks before harvest. So when you eat grains, you're eating things that have been soaked in Roundup. If they're organic, okay, you don't have that, but you still have the other two problems. Problem number two with grains is that they have gluten. And for a lot of people, gluten causes intestinal inflammation. And the third problem, which I think is actually the biggest problem with grains, is that we store them in silos prior to sending them to the mill. And in the silos, they get moldy. So when you eat grains, guess what? You're ingesting mycotoxins, which are damaging chemicals secreted by mold. And this is a huge cause of cell membrane damage. There are other things that you can do for gut inflammation, but if you're able to do those three, that's a really, really good start. And that we're going to keep it simple today. So another thing you can do is replace missing micronutrients. For thyroid function, two very important ones are, well, three: selenium, zinc, and vitamin D. Stress reduction is crucial for thyroid hormone because remember, stress was one of the big things that takes you down the reverse T3 pathway, where you, even if you have active hormone, it's not able to access the receptor. Another thing you can do is reduce the toxic load. Now, this could be an entire lecture, an entire book. I do have some articles on my website at salugenesis.com, so I encourage you to go there and look about toxicity and reducing toxic burden, but it's crucial for thyroid health. Another thing that's important for thyroid health is adequate sleep. Sleep, if we don't have enough sleep, we're going to make too much reverse T3. Sleep is really when your body cleans up. It's when the cleanup crew comes in to take out your cellular trash. Now picture your kitchen, and what would it look like if nobody ever emptied the garbage, right? That's you without enough sleep. If you have trouble sleeping, well, that's something to talk to your doctor about. And if your doctor doesn't have an answer for you, then look for a new doctor. Then, of course, the last thing, which I've kind of talked about already, is heal the cell membranes. In order for thyroid hormone to work, you need healthy cell membranes. And that, as I mentioned already, is a big part of what I do with my patients. When should you ask for help? Well, obviously, if you think you have symptoms of hypothyroidism, talk to your doctor. But before you do a little prep work. Make a list of your symptoms. That way, when you go and you're sitting in front of your doctor, you don't forget what they are, because it's human nature to get nervous or to feel rushed or to not be able to elicit what you're thinking. So taking a list is very good. And the other thing that's really crucial, I think, for diagnosing hypothyroidism is a temperature log. So I tell my patients to keep track of their temperatures for 3 points throughout the day. Once when you first wake up before you get out of bed, and then twice again at 3-hour intervals from waking up. And so you can have a little log of your daily temperatures, and if your temperature average is significantly below 98.6, that is really suspicious for hypothyroidism. Now, what about when should you see a functional medicine doctor? Well, certainly if you have lots of symptoms, but your traditional doctor says it's all normal, well, that's a reason to look for a doctor that recognizes the difference between optimum and normal. And a second reason to see functional medicine is to get to the root cause, to see if you have symptoms that persist despite medication, something else is going on. And so that's a reason to see a functional medicine doctor. Okay, we made it to the end. Thank you for your time today. I hope that I've given you some useful information that you can take to take control of your health and make sure that you have an appropriately functioning thyroid and that your body can use the hormones that your thyroid makes. I encourage you to go to my website at salugenesis.com. There's some hopefully very useful information in the article sections on that part of my website. I write these articles for you in order to help you take control of your health. If you have thyroid concerns or other concerns and you're truly interested in getting to the root cause, I would be happy to discuss that with you. On my website, I have a link for potential patients to create a discovery call appointment with me. And at that call, we chat to decide if it feels like it's a good fit to work together. I want to thank you for your time today, and I want to encourage you to go out and take control of your health and to be an advocate for your own health. And one of my favorite sayings is, it takes more than hormones to fix your hormones. So if you have hypothyroidism, it might take more than thyroid hormone to fix that. I'm happy to help if you have any problems. Please leave comments or questions below. Thanks a lot.